Assalamu alaikum. Now I would like to discuss about the approach to postmenopausal bleeding. Okay, if there is postmenopausal bleeding, that means bleeding after menopause, then transvaginal ultrasound of the endometrium should be done. If the diameter of the if the diameter of the endometrium if the diameter of the endometrium is less than 4, then just observation. And postmenopausal bleeding, if the diameter is more than 4 millimeter, if the diameter is more than 4 millimeter, then you should do endometrial biopsy. If you should do endometrial biopsy, and in the endometrial biopsy, if it is benign, then observation. If it is malignant, like atypical or neoplasia, then you should go for progestin or surgery. Progestin or surgery. Okay, now adenomyosis. Adenomyosis is abnormal endometrial tissue within the uterine myometrium. Adenomyosis is after 40. It is after 40, that means more than 40. Adenomyosis, meiosis multiparity, and in adenomyosis, myomectomy, that means prior uterine surgery is one of the cause of adenomyosis. It can cause dysmenorrhea, heavy menstrual bleeding, chronic pelvic pain. There may be globular uterus, uterine tenderness, globular uterus, uterine tenderness. Diagnosis like clinical presentation, MRI, and or ultrasound. You will get thickened myometrium, and it is confirmed via pathology. As a treatment, hysterectomy should be done. So adenomyosis after 40, adenomyosis, myomectomy, and adenomyosis multiparity. So in adenomyosis, the clinical features: heavy menstrual bleeding, chronic pelvic pain, globular uterus, and with or without tenderness. And in MRI, you will get thickened myometrium and confirmed with hysterectomy should be done. Adenomyosis typically dysmenorrhea, heavy menstrual bleeding in a multiparous woman more than 40. The continued accumulation of the endometrial tissue within the myometrium causes an increase in endometrial cavity surface area, resulting in heavy menstrual bleeding, to chronic pelvic new onset dysmenorrhea in later reproductive new onset dysmenorrhea in the later reproductive year is classic. New onset dysmenorrhea in later reproductive uh, later reproductive phase is classic. In this is uterine polyp or endometrial polyp. These are the polyps. These in here polyp, in here polyp. This is uterus, and this is endometrium. Endometrial polyps are common, well vascularized, hyperplastic endometrial glands that extend into the uterine cavity, develop around 30 to 40 years of age. Symptoms: intermenstrual, abnormal uterine bleeding, normal regular monthly painless menses, normal regular monthly and intracavitary. Therefore, small mobile non-tender uterus. There is small mobile non-tender uterus, and polypectomy should be done. It is well vascularized, hyperplastic. It is well vascularized, hyperplastic endometrial glands extend into the extend into the uterine cavity. There is intermenstrual abnormal uterine bleeding with normal, regular, monthly painless menses. This word is very high that in between the menstruation, endometrial polyp in between the intermenstrual bleeding along with normal bleeding, intermenstrual bleeding along with regular monthly painless menses. Intracavitary, there is small, mobile, non-tender uterus and polypectomy should be done. Endometrial cancer, it happens due to excess estrogen like obesity, chronic anovulation, nulliparity, early menarche, late menopause, and tamoxifen. These are the reasons of having endometrial hyperplasia or cancer. Clinical feature is heavy, prolonged intermenstrual or postmenopausal bleeding. Heavy, prolonged intermenstrual or postmenopausal bleeding. Evaluation is endometrial biopsy. Endometrial biopsy is a gold standard and pelvic ultrasound. Endometrial biopsy is gold standard and pelvic ultrasound like postmenopausal women. Treatment is hyperplasia with progestin therapy or hysterectomy. If there is cancer, hysterectomy should be done. Endometrial cancer if primarily postmenopausal with vaginal bleeding, diagnosis is endometrial cancer. If there is an old, obese, or hormone replacement therapy or SERM, think about endometrial cancer. Young with PCOS, think about if there is granulocytic cell tumor and it may present with HNP Lynch syndrome. So it may present in multiple form. Endometrial biopsy is to indicate to evaluate endometrial cancer in women primarily postmenopausal bleeding and endometrial lining more than 4 millimeter on ultrasound. If biopsy is non-diagnostic, DNC and hysteroscopy can be done. If endometrial biopsy is non-diagnostic, then DNC, dilation and curettage or hysteroscopy can be done. Endometrial biopsy indication age more than 45, abnormal uterine bleeding, postmenopausal bleeding, abnormal uterine bleeding, postmenopausal bleeding. Age less than 45, abnormal uterine bleeding plus unopposed estrogen like obesity, mm, anovulation, failed medical management. If there is a Lynch syndrome, age more than 35, atypical glandular cell on pap test, endometrial biopsy, age more than 35, atypical glandular cell on pap test, atypical glandular cell on pap test, do endometrial biopsy. So age more than 45, abnormal uterine bleeding, postmenopausal bleeding, go for endometrial biopsy. Age less than 45, abnormal uterine bleeding plus unopposed like obesity, failed medical management, and Lynch syndrome if age more than 35 or more than 35, atypical glandular cell on pap test. That is all about this. Hope you enjoyed.